Because my phone's on my bed. All right. We are now streaming live on YouTube. We will be on TikTok in a couple of minutes. So because my phone's on my bed. All right. We are now streaming live on YouTube. We will be on TikTok in a couple of minutes. And I can't mute myself. There we go.
I'm like, hold on. Are you
Like, it's
repeating
not
yourself?
me. I haven't opened anything else yet.
Right? Today it's me. Usually I come up muted, but I'm not muted today. So I don't know why. All right. So welcome, guys. It is 100% my fault that we are late today. Actually, it's the guy with the leaf blower in the backyard. So we will be in a permanent location in a second. So welcome to the wellness chat. We will hop on TikTok in a minute. Got Neil and Amanda here today because it's Happy Tuesday. Next week is at 1 o'clock as well. And then after that, we go to 11, try to catch more people. We'll do the lunch hour. We'll do Eastern Standard Time at noon, 11 Central, to get that done on the 16th. So
I will be gone.
You're going to be gone when?
That we officially we're going to roll on the 16th.
Okay. Neil, are you here on the 16th?
I think I should be back. Let me see. Yeah, I should be back.
Okay, cool.
Unless something crazy happens, I'll be back.
I know, right?
I might be able to get on in the car.
Oh yeah, true that. Absolutely. All right, let me go. I think we're clear. I think the coast is clear. Let's get us started on TikTok since no, you are not going outside. I am, the dog's not. All right, stay. I'll bring you outside in a minute. I promise. Stay. There we go. What are the chances? Slim to none. Okay. All right, we are set up. Let's get on the TikTok. What are we gonna call this? Same thing we always call it.
Weekly wellness webinar this week.
Yeah, I know. I had to change it because people were getting confused with what was what. I'm like, all right.
Oh, and I put some stuff in the live thing, but those are more for Wednesday.
Okay. All right. We are officially 3, 2, 1 live on the TikTok. So have fun interacting with your viewers in real time. Hey guys, it's Dr. Mo. I've got Neil and Amanda behind you on YouTube. So if you want to go to watchdrmo.com, you can catch their faces on the tube, or you can get on TikTok. I want to see if I can get Neil and bring him up here, and Amanda. There you go.
Working on it.
So Neil, I can't.
Yeah, you're not showing up on my phone yet. Oh, there we go.
I can see that you're joined, but there we go.
Here I am.
All right. So, hey guys, thank you so much for your patience. For those of you out there on TikTok, I had a lawn fiasco. There we go. All right, Neil. So I turned your microphone off on TikTok. I don't know if that turns it off both sides or not. Let's get Amanda up here. Amanda, you have to accept that invite. So we'll get. Let me mute that. There we go. So please follow Neil and Amanda. So that way you can see their faces and not just their little circles. We are from a company called Active Medical Solutions. And we're kind of carving a little niche here on when people can't reach their goals, they come see us. Or they're in maintenance and their doctor says, no, we're not going to prescribe your GLP-1s anymore because you don't need them anymore because you're perfect now. So if you want to be our patient, go to amstelehealth.com. And this is not medical advice. It is not legal advice. It is not financial advice. And sure as shit, not relationship advice.
And being across the internet, it sure as hell ain't HIPAA compliant. So
right. Right. And this is not the place to be HIPAA compliant. This is the place to have a little fun, drink a little coffee, have a little happy hour. Actually, the Wednesday night one is our patient happy hour. This is now going to be called our weekly wellness webinar. Yeah, I know. Lots of W's.
Weekly wellness webinar. Yeah, I got it.
Webinar. Yeah.
You enjoy a little alliteration.
So yes, I had to name it something different because public live and patient live were confusing people. So, but this is where we're going to be.
Hello, Stella.
So happy Tuesday. Happy Tuesday. I'm literally looking, I can't get, okay, there we go. Now I have I couldn't see any of my chat. So, okay. If you guys have questions about GLP-1s, what to ask your doctor, is this normal? Have one of you experienced it? Because remember, we use a lot of personal experience. We don't take medical care of you here. If you want that, you got to go to amstelehealth.com and click be a patient. Our states are listed on the website as well. And thank you very much for sharing the live. Share the live, share the love. More people will join. And then if you want to ask questions and not type them in the TikTok chat, you can go to watchdrmo.com. We're over there too. And you can see Amanda and Neil's faces and just put it in the chat over there. Wherever you want to see us.
Either
Oh,
one.
great. They already had filtered comments. Not
What?
mine. Not mine. Somebody else. Somebody else. We already had a hater.
Chicken lady shirt. That's all I said.
I don't want them. I want the haters. I don't
I
care.
know. I want to hear the
The
comments.
chicken lady shirt.
Well, if anything, it's people upset about GLP-1s, and we can maybe fix their their
Right.
negative vibe.
I mean, we have definitely turned around a negative vibe or two.
Yes, we've helped a couple of people coming in and give us shit, and we helped them out.
Yes, it was awesome.
That-
Freaking
that's
awesome.
it. Doesn't get better than that.
No, when people come in and they're like, you guys are assholes. Well, we might be assholes. That's notwithstanding.
You're not wrong.
Right?
No
Yeah.
objection.
Why does it take 30 years to get a celiac diagnosis? Oh, yeah, well,
Ask about endometriosis.
true that. True that. That's not really a good answer. The good answer is there are a lot of conditions out there that either we don't have definitive testing for that's super reliable, or it just took you that long to get to like kind of the right people or the right doctor. I mean, technically celiac should be a biopsy and go, right?
Yeah,
I don't know. I don't know.
and some lab tests.
Yeah, lab test, biopsy, put them together, voila, champagne. That's from a movie, by the way. Whitney, I've tried different ones. It always seems to be on back order.
We missing a comment from her?
I think we must have.
Yeah, I
No.
don't see it, but
I don't see
maybe.
the first comment, Whitney, but I'm going to say, or I have to go to a different doctor. So the prescription is easy. Getting medications, brand name medications that are GLP-1s is not easy. They're on shortage. You can actually just Google FDA shortage. There's a public website and it can tell you like which ones are on shortage, but it doesn't tell you where to find them. And there's really no definitive answer, I guess, on when they're going to be adequately produced to meet demand, aka never.
126. I'm hoping next year when they open that new plant that they're
Yeah.
just able to pump these things out. So that's what I'm hoping.
Yeah.
Or, other option is compounded.
Yeah. I mean, if you're comfortable with that.
Yeah. In the meantime.
Hopeful Mama said, not meeting calories on some days, but getting all nutrients and losing slow. Is that okay? That is freaking perfect. Getting all your nutrients in, getting what you need, not getting what you don't.
Yeah, I mean, if you're a little low some days because you have no appetite, as long as you're getting your protein intake in, I'm happy.
Same. Yep. Smith River Vintage says, does the injection site really make a difference? Because I know, like scientifically, it should not. However, in people, it does. So across populations, like study-wise, it does not. But that TikTok angle's horrible. Sorry, guys. Whatever. I looked up, I was like, ooh, whatever. I look better on Zoom from here up. What was I talking about?
Site injections.
Site injections, yes. But in a particular human, it will change the way you experience things. I've done abdomen for 2 years. Starting in 2 days, it'll be 2 years.
Wow.
All but one time. And the one time I did the back of the arm. Why I picked the back of the arm? Because I was chicken on the leg. And I had diarrhea and no appetite suppression. That was a one shit wonder, because I was like, nope, not doing that again.
Yeah, anecdotally, the site matters for individual people. Like, it's all over Reddit. Some people are terrified to switch sites. They're like, because they've read other people like switch sites and they have horrible side effects and no appetite control. It's like super weird.
But it's totally individual, much like anything else, right? But the funniest parts on Reddit with the sites are the people that have the maps of like Butt Crack North and like I'm talking like freaking coordinates on. I mean, these people are mapping this out. It's pretty funny. It's pretty awesome.
Honestly, theoretically, you could do it anywhere you have extra fat.
Yeah.
You know, if there's subcutaneous tissue, you could theoretically do it.
Nice. Hopeful mama perfect. Yeah, agreed.
Stella's I haven't lost any weight, but I'm feeling it in my clothes. Yeah, I mean, sometimes the scale doesn't move, but your clothes start fitting looser and then the scale will move.
Sid, do you think guidelines or position paper will come out in GLP-1s and previous history of eating disorders? They are doing research now on certain eating disorders with GLP-1s because some people we'll just call some people, whatever, they say not to use it with a history of eating disorders, but if it can interrupt the compulsion, I'm all friggin' for it. I'm a binge eater by trade. It's not pretty. I still struggle. I struggle 2 years into it, 50 pounds down, mental work, group work, therapy work, all the work, GLP-1s, protein, and I still struggle. So it's not a magic. For those of you out there who are thinking, oh, this is just a magic pill and you need to not cheat and do it the right way. Listen, guys, this is like, for me personally, this makes it possible for me to actually make change, right? And I wear shoes. That's Neil's comment, sorry. I just totally triggered him. It's fantastic. If you can see his face, go to watchdrmo.com just to see Neil's face. Oh, and like and subscribe while you're there.
Do it. All right, Barbara Kelly, as long as you get your protein, you're good. Yes. So for women, as long as there's not like a reason you can't have protein, like due to kidney issues, like 100 grams of protein for women and 150 for men. And that's basically based on lean body mass that the average person would have. You can go a little higher, like Hopeful Mama's going to 120. I would rather you err on the side of higher than lower. It helps with appetite suppression, keeps your muscle, keeps your hair. So super important.
And Neil eats a lot of protein.
That's why I have no hair.
No hair.
I
Jennifer,
do. I'm like 200 to 250 typically a day. So
seriously, 250 a day. That's freaking amazing. I'm too lazy to lean forward. Sorry. I'm just chilling. I've been on meetings all morning. I'm like, I just want to sit back. Okay. So Jennifer said, definitely has suppression, but hasn't lost in 8 weeks. Triple collagen and biotin have been good to me. Nice job with the hair.
Yeah. So, I mean, I think if you have suppression
yeah,
and you're not losing, you're still eating the calories are too high. So you either need to kind of calculate your calories, is one option. My first option would be to make sure I'm getting that protein in to see if I can just naturally eat less calories. So I would start my day with at least 30 grams of protein for breakfast. And I'd start there. If not, it's probably time to go up in dose to get a little bit more suppression.
Yeah. Use the, like one of the things that I said in the very beginning was allow the drug to work, right? So sometimes we're forcing ourselves to overeat essentially. And if my food is very refined, I can overeat much easier, right? I know it's not rocket surgery. I get it. But just, kind of use the drug to your advantage. And because somebody asked about, are the new compounds affordable? Don't waste your money on the drug if we're going to overeat it. Oh God, I say this. I'm telling this to myself, right? Like, this is not me coaching you. This is me coaching me. So then, yes, that brings us to pricing.
So affordability, it kind of depends. I think our prices for the medications, it's around 150, I think, for semaglutide, and then 200 for tirzepatide for the starting doses, which I think is way more affordable than paying brand name if your insurance isn't going to cover it. And then you have to take into consideration how much money you're saving on food. I had one friend who we put on like Mounjaro when it was 25 bucks, and he was saving like 60 to 80 bucks a week on food. That would have paid for, like, right now, that would pay for his compounding.
Yep. Agreed.
Agreed.
So Jennifer said, definitely not too many calories. I do track and weigh everything. Just because you track and weigh doesn't mean it's not too many calories. Courtney calls it the mathematical hard truth. When she was eating 15 to 1600 calories, when she had a bunch of excess fat, it wasn't going anywhere. She was eating at maintenance. Oh my God. Speaking of which, I have this new app. It figured out my BMR. I don't know what I don't know. Magic, right? Whatever. There are formulas and stuff, but I always use the formula, probably the ones that I like. And it figured it out 200 to 300 calories lower than I've always used, which actually is more in line with what I track and eat when I lose and or gain. Because that's what, that's what, no matter what the TDEE says, or no matter what your RMR says, it is, if you track for a couple of weeks, because you're going to have errors, but then you learn how you track. So if you track for a couple of weeks, map your weight, map your calories, not going anywhere. You got to find a way to drop it down, right? Maybe it's substituting one thing for another, or that's all diet shit though, right? That's why in the GLP-1 world, work on the protein before noon, work on the hydration. I don't want to tell people to diet, although we kind of have to. Does that make sense?
At some point, I think you do. Like, if you're at max dose and you're not losing, now it's time to add in and focus on other things as well.
Yeah.
Let's see here. Where did it go? Debbie saying her daughter just got her first prescription today for PCOS. So exciting. Heck yeah. The patients we've had with PCOS, like, this is freaking incredible what it does for them. Like, even after they've lost all the weight that they wanted, they drop down to like the lowest dose, like every 10 days. Or I have some like on compounded, they're just taking like 1.25. So of tirzepatide, like half of a normal dose to control their symptoms.
I have a terrible problem with staying hydrated. It just seems like I can't drink enough. That is a God's honest truth, but make sure you're adding electrolytes in, not medical advice. But free water will not necessarily hydrate you, especially if you're outside and it's 95 degrees or whatever it is out here. Yeah.
There's one from above 7. Question. I work out 6 days a week and I'm on a GLP-1. Any suggestion? My mind is cloudy. Depending on what dose you're on, it might be time to go up to kind of shut that brain off. I mean, we've got patients that are pretty well.
Got brain fog.
But I guess it could be fog. Yeah, if you mean fog, like we've had patients. We only had one patient. His brain got so foggy and he got so tired. We tried dropping down and we ended up coming off, and then he kind of disappeared. I wonder if some
others that did better on sema.
Yeah. Yeah, I don't think I've heard of anybody with brain fog on semaglutide, just tirzepatide product.
What dose of sema do you usually see the most weight loss? Definitely the 1.7 and 2.4, but we do have a lot of patients that have great success lower.
Even after being on like tirzepatide product, like Courtney is, doing pretty well. Appetite's super suppressed at like a Franken dose of like 0.7 milligrams. And she was on a much higher dose of tirzepatide, Mounjaro, and she switched, and wow, I think she thought one was going to be nothing, and it hit her pretty hard.
Do you think the Lipo-C injections help with fatigue?
I think they're worth a shot. Pun intended. No, seriously, like some patients like try them and they don't ever want to live a day without like Lipo-B, Lipo-C injections because they love them. Other people get them, they're like, I don't feel anything. So I think it might be worth the shot to see if it helps you. And if it does, great. And if not, that's fine too. The other option is, just take a B vitamin for a while, like a B12, and see if that helps improve like fatigue.
I'm on 0.5 of Wegovy and will have to go down. Super, super nauseous and no appetite. For the whole week? Or, I mean, because I have tirzepatide Tuesdays most weeks. Yesterday, it was tirzepatide Monday evening. It happened sooner yesterday. Yeah, I did not. I was up anyway because my brain wouldn't stop. And then my stomach hurt and I had reflux and I was like, oh, I did not plan for this. It's usually Tuesday. So, and this is 2 years in, sort of kind of at goal weight. I'm not at goal weight. Okay. Let me not bullshit anyone out there. I am not at goal weight. I'm about 5 pounds heavier than goal weight, 4 to 5 pounds. And that's because I eat refined foods. Not any. My 80-20 ratio is the wrong way. It won't be. It won't be soon.
But yeah, if you can't handle the side effects, go back down. We've had patients that, you know, even the, you know, like be on Mounjaro and have no side effects ever, get to 10 and like, oh wow, we have to go back down. So you'll find that dose that's a little bit much for you. I mean, I think if it was me and you're stuck with Wegovy 0.5 for another couple weeks, I'd probably space it out a little bit
Yeah, give it
to
a
kind of let the levels drop a little. But yeah, I'd probably go back.
Yeah, Gabby says been on Manjaro 7.5 for 9 months, but not losing. What are the chances to lose on 10 milligrams if I go up in dose? I would definitely go up in dose. I had to go all the way to 15 when I originally started to really lose a lot. So don't be shy. And now I'm back down at 10 to 12 and a half.
It's good.
Especially been on that dose for a long time, you know, and it's some people it's just not as effective, but you got some good use out of 7.5. I wouldn't hesitate to go up. Should you take Ozempic if you have diverticulosis?
Yep.
Yeah, it's not a contraindication.
Ready? Not medical advice. Yeah. No, just
Not kind of.
I'm terrible. I'm terrible. But yeah,
I
well,
would.
let us give the actual appropriate answer of
Talk to your GI.
talk to your doctor to make sure, because some GIs are going to blame colitis on your GLP-1s.
Yep.
Remember we had that patient who screamed at us. My doctor said, you caused my colitis. Lady, I didn't eat the shit. I didn't put it in your mouth. You caused your colitis. Probably the anger you hold in yourself caused the colitis. Festering down there. Sorry.
Gigian or GG on the go. I can tell with my expression. Oh, wait, no, where'd that one go?
Oh, Jenna, I haven't seen your comments.
Oh, I think about wanting soda. Yeah. GG on the go. Have soda. Like have like a diet soda or like one of the like, if you don't mind. Like if you can tolerate them. I think the zeros have gotten so much better than the old diet sodas. But yeah, don't not do stuff and make yourself crazy.
Yeah.
Or get a regular soda. Get the little like kid cans that they send in the lunch. You know, and that's like your treat here and there.
Hold on, Jen, I'm looking at your questions.
I think she's just been giving us her support team.
Oh,
Jenna.
yeah. Sorry, I can't, so yeah, if you have questions, just put them in the thing.
No, she said hello.
Oh, I asked if you needed me to help you take your own advice. So I have employed a whip cracker. Starts on the 17th. So I will have my accountability on steroids, not literally, but I will have lots of accountability starting on the 17th. So be prepared. My husband's not going to make eye contact for 16 days. Because I'm giving up artificial sugars, or not artificial sugars. I'm giving up added sugars for 16 days, along with most all processed food for 16 days. Try to get my brain a little bit less jitty.
Macy's asking, is it okay for me to do it in a few days rather than Wednesdays when I normally do it? So you can move it forward 2 days or backward 2 days. But if you're like with the 0.5 is way too strong, I'd stretch it out to like 10 is about as far as I really like to go.
Crazy interesting comment. Lacey says, I just saw a clinical trial for GLP-GIP for hidradenitis about to roll out. Hopefully promising.
Oh, wow.
So interesting.
Well, because it
That is
decreases your
miserable.
inflammatory
Yeah.
markers, right? You've got soft tissue approximation, you've got elevated inflammatory markers. I mean, it's perfect. You know, just won't cure the male pattern baldness.
Ooh, Maureen, this is all you.
I know, I saw it.
Advice, you saw it. I'll let you take that.
Catherine, what's your advice for binge eating? I keep on binging. So my advice, number one, don't quit. Okay. Don't quit, right? Because what's the alternative? Going back to that life where you were like, I mean, my binges used to be 15,000 calories, and I'm not talking throughout the day. Over time, that has markedly decreased, but I have shown myself recently that I can't quite live a day without having some sort of turning to sugar in response to breathing, pretty much. I don't even have anything in the house. I'll find things, right? So, don't quit is my number one advice. Get the 50 grams of protein in before noon-ish. I say ish because, you know, I can't tell you to do what I'm not doing. I'm not truly binging anymore, which is great. But there's got to be a reason. So for me, I've got to interrupt the drift. I've got to interrupt the cycle. I don't know how else to do it except for really to detox. And my God, I hate that word because my liver does a great job of detoxing, right? I'm not doing a detox, but the thing is I need to interrupt that brain cycle of I'm uncomfortable, I'm happy, I'm sad, I'm breathing. Let's go reach for some sugar. It's convenient. Let's go reach for sugar. My brain has these Audubon size highways where that's just, it's an easy fix for me. It's been for, I don't know how many years, 45 years, more than that. Lots of math going on in my head. So, yeah. And I will actually, so I'm actually starting a life coaching group that I can help with some of that with too. It's a little bit deeper than this. Not medical advice. It's completely the coaching aspect, 100% the coaching aspect. It'll actually make these lives only an hour long because that second hour is going to be a VIP call. So if you're interested in that, just throw me a DM that says the word success and I'll give you the info. Starts on July 16th. Catherine, I love your life coaching. Where do I sign up? Yeah. Just send me a DM with the word success. Here, can somebody put success in there? Because I'm going to do it on my phone. I'm going to mess up the comments or I'm going to turn off the live. Just all capitals, success. We'll get you out. Yep. Done. Great. Perfect. Yeah, it's way cheaper than it's just, I keep having people ask me, listen, I don't want to do the entrepreneurship thing. I don't want to start a medical practice, but I want your life coaching. So we're going to do a VIP thing. For right now, it's going to be literally me for an hour on Tuesdays. So, fair warning. Great. I shouldn't tell people that. No one's going to freaking sign up for that shit. They're like, So anyhow.
Michelle's asking, what is Zep? So we're talking about like Zepbound, which is a tirzepatide product. If you heard of Mounjaro, that's the one for diabetes. Zepbound is the one for weight loss. It's a GLP-1 and GIP medication to kind of help with weight loss, kind of helps with mind control with the cravings of food. And kind of it helps metabolically repair you from the inside out. So you can actually lose weight.
And yeah, you can lose weight. Your body uses food better. When you do have indiscretions, dietary indiscretions, aka Nutella out of the jar.
Yeah.
So I told you I didn't have anything in the house. And because I live with other humans, so there's that. But when I do have those dietary indiscretions, they do not trip my switches. They don't cause as much inflammation. My body can use it. I don't have a shit ton of weight gain. And it doesn't cause that over and over again feeling. So it really helps me. So Leah, let's talk about what else we do, right? So we are from a practice called Active Medical Solutions, amstelehealth.com. You can see our states there, what states we serve. We are now in Pennsylvania and Mississippi. Those are new this week. Technically it was last week, but I kind of forgot that we were in Mississippi until somebody reminded me. So yes, we have Pennsylvania, Mississippi now. So I don't know how many that is total. And I'm not going to try to name them. I'm not happening. Go to amstelehealth.com. But all the Miamis, we serve all those. All the Miami.
Right. Maybe Ohio, maybe Florida. I'm sure there's one in Miami, Texas. Why not?
I'm sure there is. I'm sure there is. So we are a lifestyle medicine practice. So what we do is we do a ton of GLP-1 prescription writing for our patients. We do urgent care for our patients. at no extra charge. You know, it's included, and you get unlimited text messaging with the team to get your shit done, which is pretty cool. And we have someone manning the lines 21 hours a day, I think now.
Yeah. All through Monday through Friday, and then Saturday and Sunday, they're still there. We're still
Yep.
there working.
7 days a week.
So if you got side effects on Saturday, we can handle it, as opposed to you wait until Monday to go see your doctor.
Yep. And or sitting in the ER for 6 hours for nausea. Sorry.
Yep, Michelle, we are in Tennessee.
Oh yeah, you can ask states. That's easy. Yeah, we can do we can
I know my states.
know them. It's just to list them now, they're actually getting pretty long. So, all right, what else we got? Can you explain what metabolic repair is? So that's actually, this is not a scientific use of the words, I guess. This is more of an anecdotal use, right? We're not saying we perform double-blind studies and well, they have, but that's not the point. We did not. We as a practice have not. And we as patients, remember, because we have the patient and provider side. I have personally been on a GLP-1 for 2 years on Thursday, it'll be 2 years for me, which is amazing. So, and I have no plans to go off. So feel free to ask about that. None. You can pry it out of my cold, dead hands. So, hopefully that will be a long time from now. Metabolic repair is a lot like with PCOS, for example, you are insulin resistant. I was never insulin resistant in my labs. My labs look great, except for my cholesterol. That's always been a little high, but my cholesterol is going down. I can tell that my body can use food better, uses food differently. When I do endurance events, I sweat more salt. I never used to sweat salt. You know, I'm actually doing what my body is supposed to do because I've abused my body with food since I was 5 or 6 years old.
Well, that, you feel the appetite suppression, you feel your stomach getting full faster, but on the inside, I mean, it's helping how you use basically fuel. What you're using fuel, it helps increase your insulin output. So it's doing stuff you can't feel on the inside. I guess that's kind of what we call metabolic repair. That, and so you can use the fat that's already stored in your body, is that actually using it as opposed to just having it sit there.
Right. Yeah. And it just sits, and it sits there. And the bad part is it sits there. And when you have excess fat, it actually becomes its own endocrine organ. It stores hormones, it puts out hormones, it messes up your feedback mechanisms with appetite and satiety. Ugh. Yes. Just started last week on semaglutide 5 mLs. So we don't know what the dose is. I hope they started you at the lowest dose because this person's eating was rough. I'm hoping that they started you at the lowest dose.
Hope so too. But yeah, just the biggest thing would be to make sure you stay hydrated, use electrolyte drinks, and then focus on your protein. And kind of go from there. When I used it, like my first week or two was pretty rough. I struggled to get any food in. So I just focused on my protein. Eventually got a little bit better. I still had really good appetite control, but it did get a little easier to eat food.
Paige asked, should I change to Zepbound from Mounjaro since I'm using medication for weight loss? It's a different color label. The medication is the same medication.
Yeah, if your insurance is covering Mounjaro for weight loss, I would, and Zepbound, I wouldn't change a thing. Oh well.
Yeah, 40 to 60% of medications in the US are prescribed off label. So if anyone makes you try to feel bad about that you're using it off label, tell them not to take aspirin for their cardiac concerns.
Yeah.
Or just don't listen to them. Do your thing. You do you, Rue. Injection question again.
Yeah. Does it make a difference in how well Ozempic works depending on where you inject the medicine? For some people, yes. Some people have better appetite control in certain locations. And other people and sometimes they have more side effects when they switch sites and no appetite control. So if it's working well wherever you're injecting it, I probably wouldn't change it. If you want to experiment, go for it. But if it's working well, I wouldn't change anything. Let's see. I'm on Wegovy first dose, feel nothing and not curbing up hunger. Yeah, so depending on when you gave it, like the semaglutide products will usually work, but the second day you'll feel a little something. Sometimes it does take a second dose to kind of get the levels up. It might not be your dose. The 0.25, the 0.5, the 1, they're all considered escalation doses, so you can adjust to the medication to get to the actual weight loss or doses at 1.7 and 2.4. Some people are just lucky and the lower doses do incredible things for them. So just keep going. You'll find your dose. I would not stop. I've only had one patient not respond to semaglutide. The others just had to get a little higher. Usually 1. I don't think I've had anybody feel nothing at 1. How much protein is recommended a day for weight loss? So typically we have our patients focus, like females 100 grams, males about 150 grams, to help kind of help with satiety and appetite control, and to help keep muscle mass. Without that protein, you're going to lose muscle. Anytime you're dieting, you're going to lose muscle. So this will help prevent it. This is the only other thing you can do is besides strength training. And if you're getting like 60 today and you're struggling to get 200, that's okay. That's not uncommon. Just kind of keep, it takes some time to develop like a plan and find things that you like to kind of get it up there. So just keep working at it.
So this one, I see a lot of people doing maintenance on 7 to 9 dose, and that scares me. First of all, don't listen to anybody else. And I'm currently at 0.5 mLs on a GLP-1. So 0.5 mLs, we have no idea what that dose is. Because if it's brand name, 0.5 mLs could be anything from 15 milligrams of Mounjaro to 0.5 of Wegovy. Wegovy, it's the right one. Depending on the pen, or if it's compound semaglutide or tirzepatide, the concentration will vary widely. And people on maintenance, well, like I said, everyone's going to have a different dose. And I have a different.
Sometimes the dose changes
Yeah.
each week. You might be on like, let's say, use tirzepatide 5 milligrams for several weeks, and then you're like, I'm cutting a little more noise, and you take a dose of 7.5 and then go back to 5.
Or you take
just kind of break that cycle.
5.
All right. How long can you typically stay on the starting dose? As long as it's effective, Julie. If it works, I think we have one patient from last week that she's lost about 100 pounds on the lowest dose. She's never had to go up. I think she did once and it made her really sick, so she went back down to 2.5. So as long as you're having appetite control, you're losing weight, and I would stay there. I mean, Mo, you lost pretty much most of your weight at like 2.5 and 5, or almost all your weight.
Yeah, I lost everything on 2.5 and a half, gained 8 pounds back. Struggled a lot with food noise, binging, overeating, sugar shit. When I eat sugar, it negates the fact that I took the drug. So I have to go up in dose to interrupt that cycle. So, yeah, the next one, my clinic said I could inject half dose twice a week. Is that okay?
Yeah, we've done that lots of times with our patients that like 2.5 is just not enough, and then 5's too much for them. So we split it up and they do like 2.5 like Monday, and then like Wednesday, Thursday, they take the other 2.5. It really eliminates their side effects and it gives them much better appetite suppression. Sticker on my vial box says Hollandale. How can I verify it actually came from them? I don't know, other than calling them and asking them like, hey, is this one of your lot numbers? I think that's kind of the only way you'd be able to tell.
And they should have, oh no, because if you got it from a clinic, I guess, then wait a minute. How does a clinic do that?
Because it should have came right from Hollandale.
So hold on, here's my random thought. These are prescription medications that go out to individual people. How would a clinic, because the ones that actually just inject you with who the hell knows what, right? When they don't have a label on it, how does that, unless it's shipped to the clinic with the patient's name on it and the patient just doesn't see the name?
It's possible. I know when some of the pharmacists, this is like 2 years ago we started this, when I was trying to set up accounts with them, they're like, do you want like product for your office? So
like, how does it work?
I don't know.
Unless maybe because you write the prescription in the office, but then you become a dispensing pharmacy, and I'm not doing that.
Yeah.
We are not legally a dispensing, we're not any kind of pharmacy.
I may know of people in California who get SLC drugs. So people do things.
We don't do things.
No.
We don't like being.
Yeah, I guess the answer to that question is if you order it from us, it will come directly from whatever pharmacy we are sending your order to.
Yeah, because
Yeah,
we
I
don't
mean,
Come
have it.
through us.
Like
you
we
can always
like,
text them, email them.
yeah, you can email Hollandale or call them and ask, I guess. I don't understand. Yeah, that's just a weird thought. I never thought 2 years. I haven't thought about that.
That someone's counterfeiting some Hollandale stuff.
Well, I think it's more of a drop ship situation, maybe.
Yeah. No, they buy from Hollandale and I buy a 1 ml vial from them for $300 for 6 weeks.
Interesting.
So you're also the 6 weeks thing that goes beyond the FDA recommendation for puncturing a vial. Unless they put it in 2 vials, then that would be 6 weeks. But you're supposed to, day 28 should be the end puncture. So 5 weeks max, really, by the FDA.
If they've tested it farther, they're allowed to put a longer date on it, but they have to show, like, they have to test it themselves. But I mean, yeah, FDA went to that strict 28-day rule based
I mean, I'm
on
not saying I agree with it. I'm just saying that's what the FDA says.
Hope. Is it expected to lose more weight on 15 milligrams of Zep versus 12.5? Not necessarily more, but it might get you going again if you've kind of stalled. We've had patients kind of go up and then come back down, and get going again. So, but yeah, if you're not losing weight, you have no appetite control, it's time to go up.
Yep. So yeah, I get mine from a clinic too, and spas also have it. Yeah, lots of people have it. So if you're on 0.08 twice a week, I can't do math. What the frig? My brain is fried today. I worked so hard yesterday. I'm like, yeah, I'm done. I got nothing. So
0.08 what? I guess
so well, no, if you think about,
units?
because that dose doesn't work, does
Yeah.
it? Oh,
Dude.
wait. So no, wait. If it's okay, I'm doing too much math.
8 units.
8 units, which would be 2.5 from Hollandale, I think. So if it's tirzepatide, I don't know, but I don't know what their semaglutide is.
No, the dosing we have, none of them are 8 units.
Okay.
So the clinic might be doing their own thing.
So yeah,
There's a 75 unit for 7.5 milligrams of tirzepatide.
shit. Inject a lot. My vial is 90 days. And that's fine. Clinics can go against the FDA. We just don't.
Yeah.
I mean, we have we're pretty straight. We're not pretty anything. We like, we are like, there are hard stops. There's shit we don't do. We don't do controlled substances. We have literally like 3 patients that we do testosterone, and I could probably hit each one of their houses with a rock right now. Like it is in person only, like it's. So we do.
Hello. I hope more doctors open their minds to maintenance. Absolutely. There's some
yes.
doctors, you get your weight and they take you off the meds, which makes no sense, which we've got a lot of patients because of that, because their doctors stop them, like they hit like a BMI of like 24.9 and
Your
they
problems are solved.
Yep. And that's just not how it works.
And plus, I mean, even the Zepbound, I think it was an Hippocrates, it's chronic weight management. This isn't about weight loss, guys. It's not about weight loss. It's health management, weight management, longevity, giving yourself the brain space to actually make good changes. Metabolic repair. You think this body that I abused for 45 years is going to turn around in 2? Did I do it on purpose? No, it's not like I didn't try, by the way. I'm stuck at a 20-pound loss. Yeah, Jess, all
I'm
right.
stuck at 20-pound loss of skill, not budgeting more. If you have an appetite and weight's not coming off, it's time to go up and dose to get it going again. Will tirzepatide work better than Ozempic? For some people.
I'm team tirzepatide all the way.
I know your team's in studies. Yes, tirzepatide works better than Ozempic. In individual people, it's very individual, and someone might do better on one than the other. If you're on Ozempic and it's working well, and you've gotten it, and you haven't maxed out, I'd stay with it. If you're like max dose, and you're like, I'm barely losing or I'm not losing, I think switching might be a good idea.
I'm going to ask a favor for everybody on here. Please do not tell us your dose in mLs, okay? Because we have no idea what that is. I want to help, especially with conversions. We want to be able to help with general information as much as we can, right? Because this is not medical advice. If you're our patient, text a picture or whatever you have. That's the best way to do it. But, you know, for here, it's a lot of general advice. We can't help if it's in mL. So if you can buy a 3 ml vial for $7.50 and it's 8 units on a 1 ml syringe, I still have no idea what the milligram dose is of, because the dose, that's the dose of the drug. Remember, this is stuff that they put in water, essentially.
Yeah. I mean, we've had patients, people with tirzepatide or pharmacists with tirzepatide, it's 10 milligrams per 1 ml. And I think the highest I've seen is, I think, 30 milligrams per ml. So you're taking a third less.
And sometimes when we'll switch our patients, or our patients will choose to switch, because we don't tell you which pharmacy to go to with our practice either. You choose the pharmacy, because we are not a dispensing pharmacy. We get no kickbacks, no nothing. But when people would switch, we've had people say, oh, it can't be this low of a dose. It can't be this little bit. So they inject more. Bad idea.
I had some very high my first semaglutide was super high concentrated, and I think I was taking like 4 units or something like that. I'm like, what? That's nothing. Wow. Within an hour. Wow. Yeah.
Yeah. And that's just it. It's like those people who come into the ER and like, this pill's really little. I bet it doesn't do much. It's nitroglycerin. It does.
Gonna give you a bad headache.
Right. And you're going to be on the floor.
All right. What dose do you recommend to lose 30 pounds?
2.5.
Not specific dose. Yeah, I'd say start and see where you need to be. Like 2.5 might be your dose, might be 7.5 or tirzepatide. You won't know until you try. Everybody's different. It's impossible to tell. I've had really big guys lose a lot on low doses, and very small women, short, small, struggle to lose on high doses. So
individual, and it's so weird. And we have not been able to predict it. We have had over 4,000 patients come through, and they, there's no way to predict it. There really isn't. Not at all.
wonder if my SEMA is related to my low vitamin D levels. I'm on vitamin D 50,000 units once weekly now. So sometimes just being overweight will lower your levels of vitamin D, unfortunately.
Yes. Volume.
So, and some places recommend taking vitamin D along with the GLP-1s to help with weight loss.
Nature Lover said I don't have to be a BMI of 27 either. My start weight was 125. And at AMS, we talk to people. We were talking about this before as my lawn guys were in my office here. How dare they? And they usually come on Wednesday. But because we don't know if this is a 125, did you start here? Did you end here? I mean, I weigh 121 pounds. I take it every Monday, so, and my dose went up. My dose went up on 121 pounds. Why? Because it's not about the weight loss. I mean, that's food quality, but that's got to come from here first. So, we talk to our patients and we ask why. What are you doing? Because people will come in, a lot of times ask us, can I use this to lose 10 pounds? Well, it depends. Have you already lost 90? Do you have a lot of food noise? Do you have joint pain? Do you, what are we looking at? Do you have colitis where you can't plan a 7-mile run without bringing toilet paper,
Or are we just using it to like control your PCOS, or
Right.
like you lost all your weight, you're just tired of thinking about food and you don't want to lose anymore. You just want the brain to shut off.
Oh my God, generic Victoza came out.
Is there any supply?
I don't know.
It's already on shortage.
Right?
Yeah.
It's 8 years old out.
That's just crazy though, because if I had a facility that could make that and put it in the pens,
Right.
why would I make the generic? I'd be contracting with Eli Lilly or Novo Nordisk to make the better med. I know it's not cheap and generic, but ugh.
Oh my God. June 24th. How the frig did we miss this? Oh my God. Hold on. Let me look at the FDA shortages. Oh my God. Thank you so much, by the way. Thank you. Thank you. Thank you. I don't know how we missed it.
Oof.
All right, what are our thoughts on Wegovy? We love it.
Early
generic-
shortage.
Of course it's 100. That's,
Oh, no, this was, okay, the good news is, first posted, let's see. No, they only have the brand name, but it's in shortage.
Yeah,
And they have
just looking up liraglutide, the cheapest I can find it is actually Walgreens for $3.34
a month.
per pen, for 1 pen. Or no,
So
3 pens. It's 1 carton, 3 pens.
that's
Three
brand name.
thirty-four. Yeah, is it? Because I just have it typed in as liraglutide. But otherwise, like some places, 863. Why for that much money? I'm gonna go for the
According
coupon
to
and jump
Teva, the
on.
whole, okay, so, oh, seriously? So here's an article. I'm not asking, we'll see. I don't know how correct this is. According to Teva, the wholesale acquisition cost of its new generic will be 13.6% lower in price than Victoza at $469.60 for the 2-pack and $704.40 for the 3-pack. So they brought it down 13 fucking percent. That's it.
Yeah, that cost, I would absolutely go for the better products.
Sorry
in
for being
studies.
angry. Sorry for being angry. I'm not sorry for being angry. I'm sorry for being mean.
Nature lover. But so many online places won't let you under 27. Yeah, and that's not us. Because it's all
Well,
about
we're
a
gonna
conversation with the provider and where you're at.
We have to talk to you. Funny that, right?
Before I hopped on, I was reading one of the online places won't prescribe the GLP-1s if you've had general anesthesia within the last 6 months. I don't know if they're like terrified. My guess is that maybe nothing lingers that long, but I'm assuming they're worried about a bowel obstruction.
Okay, first of all,
That's insane, but
Well,
yes.
I mean, or obscurely the storage of anesthesia in adipose tissue, but come on.
not
6
for
weeks.
that long. Well,
I could say 6 weeks. Maybe there was a misprint.
yeah, I could agree too. I mean, most of the time, once your bowels come back to normal, we're okay with you restarting.
We're going.
People can make misprints. I was reading a radiology report yesterday, and they said to follow up on somebody's cyst in 6 to 8 hours. I was like, thank you.
They're dictating that and half asleep, sitting in
Right?
a dark room in their underwear. Hopefully, at least they have pants on.
Oh, we're going to hell. It's fine. Okay, so which online places will allow you to purchase under 27? So it requires a prescription. So it's about the prescription. Pharmacies, some pharmacy, whatever. If a pharmacy tells me I can't order what I want, they're practicing medicine without a license, and I don't appreciate that. But so I love books. Or I love Book Talk. I love books too. For most telehealth, you have to put in that your BMI is higher to get approved. That's called lying and fraud. Please don't do that with us. We don't lie to you. Please don't lie to us. And I'm not being a jerk about it. I'm just saying, if you come to us as a patient, we are trusting. And this actually says in our crappy sign, just be honest with us, right? Because we'll work with you.
Yeah.
You know, I'll lie with you.
Ina has a good question. What advice do y'all have for someone scared to take medicine due to anxiety of side effects? If you're doing compounded, first of all, most people, as long as you're started appropriately, have minimal side effects. Is if you go up appropriately, it's all very fine. So don't be scared. But I understand if you hear horror stories that it can be somewhat nerve-wracking. But if you get a compounded medication, you can start at a half of a beginning dose. You can start very low. And then, if that goes fine, repeat that half dose in 3 to 4 days. Lots of flexibility with compounded medications. And even if you're going to eventually go on, if you're approved for your insurance, you can ease your way in with the compounded and make sure that you can easily take the set dose from a prescription from the retail pharmacy.
That's something that we do with our patients. We're not going to run that from TikTok because, that'd be dumb.
That was not medical advice.
Right.
Yeah.
Right. But, if you're our patient, we do that with some patients because they've got terrible anxiety, and, we'll walk them through that. That's the thing. It's finding a provider that you connect with, right? Finding a group of providers that you connect with to run your care well.
Yeah.
Right.
I think the biggest side effect at first is going to be like a little bit of dehydration, headache, like that first day or two, and then some nausea. And we have sent nausea medicines to the pharmacy while the patient's waiting on their compound to get sent to them, so they're prepared, and we're there available every day. So if you start on a Saturday and you have nausea Saturday, Sunday, like we can send you a script. But yeah, I think you just plan for your side effect management ahead of time. Rebecca, I love Wegovy and the semaglutide products. They're fantastic. Let's see. Jess, BMI is 27, no comorbidities, high cholesterol would qualify me for Wegovy, right? For some insurances, yes. A lot of insurances keep changing things. My insurance actually went from a BMI of 30 with or 27 with comorbidities to like
35
32 or something like that with two comorbidities.
Whatever.
And then if you get to 40, they just want you to do bariatric surgery. So they're if yours is that way, I'd call them and ask them lots of questions.
Yeah. So our cheapest semaglutide is 150, depending on your state, for the lowest to starting dose. Our cheapest tirzepatide is 200 for the starting dose, sort of. Weirdness. Yeah, roughly 200. 150 and 200 are about it for the pharmacies that we have. Florida. Welcome from Florida. I wish I was in Florida. I mean, granted, I don't know, it's 800 friggin' degrees here, so what's the difference? You know what the difference is? I don't have a sliding glass door coffee and an ocean breeze. I'm just saying. With Florida, it's about the same, 150. That doesn't sound, so 160 for semaglutide and then 210. So it's $10 more for Florida, it looks like. I think, but I didn't check Empower. 155.
We have a couple, where we go.
Yeah.
Assume that South Carolina and Kentucky, we do not have those states, but we do have providers that we are very familiar with and trust. And I can never remember their websites.
Nope, Maribel Telehealth. I'm looking her up and she has not put her states on there yet. Maribel, are you here?
If you're here, Maribel, you're getting spanking. Virtual spanking. Been a week.
Yes, Maribel Campos is our PA for California and other states. And I think Kentucky might be one of the ones that Nikki's not doing. Hamilton Telehealth and Maribel Telehealth are the two sites you can go to for care if our states are not there. Do we dry ice ship? We don't ship anything. So we are not a compounding pharmacy. We are not a dispensing pharmacy. We only are a medical only.
Yeah, they typically put them in an ice pack in it, and usually it's overnight shipping. Some of them have stopped shipping like Thursday, Friday, so it doesn't sit in a FedEx truck over the weekend. Gamma, best electrolyte to drink. Whatever electrolyte that you like. Honestly, Body Armor Light is great. It's just lower in sodium. Liquid IV is great. It's higher in sodium. Some people think it tastes like seawater. You have to dilute it. Prime, Gatorade Zero, Ghost.
I'm hydrating.
Hydration. It's just kind of whichever one you drink. I'll when it's on sale, like I got the Ghost because it was $1. Give it a go. But otherwise, I bought a big thing on Amazon. It's like 125 servings for like $20. And I do it that way, mix it with some water. But at the end of the day, it's whichever one you will drink. Like if you like the flavor enough to drink.
So Megan something. I was on Mounjaro for 8 weeks and no weight loss. If you're anything like me, same. If you're only on it for 8 weeks, if you're on commercial Mounjaro, you're only at 5 milligrams. I took till 7.5 before I really felt like anything was truly going on, and probably till the 10s are up until things really started moving. So I don't think 8 weeks is enough on this medicine to really even know what your dose is. That's my 50 cents. That's not medical advice.
Yes. I can't, can somebody throw Maribel Telehealth and Hamilton Telehealth in for Kentucky, in the TikTok chat? I just waved at Nancy inadvertently trying to comment. So I'm not touching my phone. I'm like, hi, how are you? Oh, I'm telling you, I'm not TikTok genius. I am not. Yeah. So, Propel's fine. Whatever you want is.
Yep.
I got gluten-free greens. They taste awful. So do regular ones. Like, so here, in the morning, I do my AG1, right? I do 5 ounces of water. I've increased it to 5 ounces of water from 4. I'm literally like going up, trying to get my life together, I just want a little bit more water in the morning. So I shake it up and it cannot be super cold because I have a straw, college style. And I have a straw and I drink it as fast as I can. And then I wash the cup and then we're done. Like it's just, and actually I kind of welcome it because it's part of my little ritual now. So it's what I do. Yeah, they all taste awful. And the Bloom, because it's artificially sweetened and they tried to make it taste good, terrible. In my opinion, maybe somebody else would like that. Somebody asked a question that I wanted to do and I think I lost it. I'm back. My FedEx delivered my wonderful med. That's awesome.
Nice.
What is Nikki's again?
I'm
I
gagging.
got Hamilton Telehealth and Maribel Telehealth. I threw it in the comments.
Oh, I did too. Okay.
Okay, cool,
Yeah.
perfect.
Linda, you couldn't stand the Bloom either. And it ripped up my guts like no other. And of course, what do? I try it when I'm traveling. Yes, we do Arizona.
Yep. Where to go? Mommy
List is
something.
on there. Scroll up, you'll see our list.
In 6 weeks, I'm down 8 pounds. That good start. That's a fantastic start. It's more than a pound a week. Love it.
Coconut Bloom was the only one I liked. Yeah, I could, in orange juice. Yeah, I could. Yeah, but I just, man, it tore up my guts and I was away for a conference and that was a terrible idea. Arizona, hold on. Arizona. I don't have my reading glasses on. I should not be doing this.
Let me do it.
Yep. Thanks.
Oh, now I gotta find my own comment. Alabama, Arizona, Indiana, Louisiana, Mississippi.
Price. Don't do that. Don't do that. We need the price.
Wait, what?
We need the price. 7.5.
Oh,
Cheapest 7.5. 330.
for which state?
Arizona. 330, 345, 470, but that's for 40 milligrams. Because they dose it by milligram. Remember when I talked about just help us out and give us milligram? The pharmacies don't do it like Mounjaro. Remember the Mounjaro grab and stab pens are like 5 milligrams per pen. Wegovy, 0.75 per pen. These are in a vial, so they come with like 20 milligrams of drug or whatever. I'm trying to think. The cheapest, it looks like, I'm gonna have to come all the way back here. Let me just enlarge this. 380. Ooh, that's expensive. 340. So it looks like 330, 340 for 7.5. We have a few of them. And that does not include our medical fees. Oh yeah, we didn't talk about this. So if you want to be our patient, go to amstelehealth.com. Yes, we can help you if you're 26, unless you are trying to fit into a wedding dress and that's just garbage. And you don't find us for that reason. We're not.
No, she's taking it because she has food noise that's come back and her doctor telling her it's too low. Absolutely. That's what we do. Doctors stop treating you and we continue.
That's going to just, I'm going to do it. I'm going to do it. I'm going to go off. I get so angry at that. Tell me you've never had food noise without telling me you've never struggled with food. It was like my doctor, right? And I go to this doctor thinking that he's going to have he's an older, fit physician, male, because I think he's going to have a stronger personality, right? Whatever. He gets strong, all right. Just dismissive. Whatever. How do I fix constipation if my calories are so low? Part of the reason you're constipated is your calories are so low. Like there's nothing to poop out. Now that being said, I struggled like no other. The greens help, whichever kind you can tolerate. I do AG1.
Did you see there's a gummy?
I saw that. I saw somebody said they're going to try gummies. Yeah, I don't know. We can help.
But I would say lots of fluid.
I'm so angry at that comment. I'm sorry. My doctor's telling me I don't need it. Good. I don't need you as a doctor either. Sorry. Go ahead.
It's okay.
Those just trip me. I just can't stand it.
Yeah. Kathy recommends magnesium. But lots of fluid and Miralax if you need it. I mean, and maybe don't expect so much people. Like, do you feel constipated or are you just pooping less?
Hold on.
Gorman asking.
Gorman said I'm tilted. Hold on.
Ah!
You don't have to stop.
Okay, Gorman's
I know,
asking,
but
cost for Maribel
I
telehealth.
was sick.
I am not sure how much Maribel costs, but I think she's the same. I don't think she charges you just to discuss things.
Yeah, I don't think so. She does video visits for everybody. I think she's maybe $99 because she's a little bit, she does video visits for everyone. She's just like, yeah, I meant upset. Oh, yes, I'm very tilted. That's fantastic.
We're over there adjusting.
Oh, for God's sake, Gorman. Yes, I'm not a boomer. Close. Shut up, Neil.
Susan Ramos, www.amstelehealth.com.
This one, I don't know if we got this one. Nature Lover, I'm confused. I thought you offered the meds online. So we are an online provider and we order the meds through a compounding pharmacy, which you get to pick. I think we have 6 or 7 pharmacies. So 7, and it kind of depends on what state you're in and what you want it mixed with. The prices, like we let you choose. Most people choose the cheapest one. Some people choose one that has like B12 versus carnitine. But yeah, we do everything through asynchronous telehealth through text messaging. And then we do a video visit with all our patients. And you can do that in the beginning. You can do it after you've been on the meds for like 4 to 6 weeks and, discuss how things are going. We come up with a plan. Some people do it before they get their meds.
My personal favorite time is after you've been on it for a minute.
Yes.
Because what?
After you've been on it for like at least to the first refill, because then we got something to talk about. I mean, I'm happy to like project, but it does seem to be more useful, at least almost a month in.
Yep. So Kate asked, what is our cost without insurance for Ozempic? My current one is $497 a month. We are not a pharmacy, kind of the same thing. Ozempic brand with the coupon, I don't even know if there's a savings card. So semaglutide compounded is roughly $150 to start with the pharmacies that we work with. Our cost is $89 a month. All that crap is at amstelehealth.com.
We have ones lower than that a month.
Huh?
On semaglutide, almost all of ours are lower than that, even at the highest dose of semaglutide.
Yes. Yeah. $500 is, but I'm looking if it's Ozempic brand.
Yes.
Because
Ozempic brand is Ozempic brand.
Well, no, because I'm looking at, like, I don't know what savings cards are out there, honestly, because, well, Ozempic you can get. Now, granted, I say you can get it, but some pharmacies won't fill off-label because they have some sort of moral hang-up. That's fine. They can do what they want. Savings, support, and resources.
I'll type it again.
Thank you. Thank you. Thank you. Sign up and save. Okay. Savings card for Ozempic. $150 for a 1-month prescription. So it's $150 off a month. So roughly $850. So you must be talking about compounded semaglutide then. If that's the case, yeah, our cost is $89 a month. And then you pay up $150 for semaglutide from whatever pharmacy you choose. My lawyer is a stickler. We have to let you choose. We do not make choices for you. We give you education to make the choice. That's what we do here though too.
Susan, you're saying, can you spell the name of you guys are saying it fast and I can't catch the name. I threw our website in there if that's what you're asking about.
Probably.
I'm not seeing your comments, Neil.
You're not?
Oh
No.
crap. Okay.
Which is weird because I don't see yours. So
Okay.
Okay, so it is
Fine.
why? Okay, hold on. Because somebody told me I could put a link or something in the live. Hold
above your
on.
head, on your forehead.
Enhance. Can I do something more?
Enhance.
Oh God. Draw and guess. We could play charades.
Huh, can't see mine in the comments. That's weird.
We could do a lightning Q&A about
Yeah, amstelehealth.com.
They can't see either of our comments?
That's weird.
Very sad.
I'm trying to figure this out. I don't know. I don't know. I'm gonna try to comment.
Yeah.
Okay. Oh, maybe it's because I'm putting it in like a website.
Maybe that's it. Because
Oh,
Hopeful Mama threw it in there and
Yeah.
you can see hers,
All
but I can't see mine. Yeah, you have to space it out. So it's not a website. I gotcha.
All right, so I put okay, so I put spaces in between. AMS Telehealth, Active Medical Solutions, amstelehealth.com.
I see yours, but I can't see mine. Okay, good to know.
Live and learn.
See here.
And enjoy this. This week and next week are the last 2 weeks that we go for 2 hours. Okay, we're doing an hour next week.
Let's see here.
Or
60. Brittany, is protein essential to weight loss or just preventing muscle loss? Well, I mean, it's going to help prevent muscle loss, and I don't think you absolutely have to have it for weight loss.
Really not.
But the idea on the side of eating more protein, one, to keep that muscle, because if you end up losing weight and you lose all your muscle, and then you get off the medicines, you have nothing to keep the weight off because you have no muscle to burn it anymore. That, and while you're losing the weight, it helps you stay fuller longer. Now, if you can't get up to 100 grams of protein a day, just because it's difficult, because you don't like protein that much and you're getting close, 60, 70, 80, 90, I'm happy there, but I would err on the side of higher protein. Yeah, I see you're giving me a follow. So yeah, it's just the websites.
Okay. Yeah, all right. So it must be filtering I bet it filters links. When it says these links have been, or these comments have been filtered to protect the community.
Yeah.
Dude, the community's asking, are you happy doing protein shakes? Yeah, it's really the only way I'm going to be able to get in. Yeah.
Absolutely. So in the beginning, when you have zero appetite, or if you go up dose, you have zero appetite, protein shakes. If you are, not wanting to go up and you're having some appetite back, I would switch to whole foods, because it's going to take a lot longer to digest, some chicken or some steak, than it is to get that drink through your gut, that liquid stuff. I mean, they even say with trying to lose weight to not drink too much fluid around the meals, because it helps that gut empty faster.
Are these medications as good as having gastric bypass? Funny you ask. So
Opinion.
Right. They both have their place and value. Before I started studying for obesity medicine boards, I was a staunch against bariatric surgery because of all the complications that we saw in the ER over the many years of doing this. So now, though, the more I learned, the more I realized how valuable bariatric surgery can be. I think it really depends. I think are they as effective number-wise? Yes. The ones that are coming down the pike, the triple agonists, absolutely. The problem with the insurance companies, for example, is this is going to be a lifelong thing. Now, if you look at bariatric surgery, the rebound rates, success rates, you're going to need something else later anyway. So, for me personally, I can't say that because I was never large. No, I've actually considered bariatric surgery. I considered bariatric surgery because I couldn't stop eating and I didn't know how to stop. Like I couldn't stop.
I would say better. At least if it was me, I would try the medications first to see if they work. Because at the end of the day, you get to keep all of your stomach to help absorb stuff. Because that's the big, side effect is that you can't absorb vitamins and you're taking like liquid vitamins the rest of your life. Sometimes, and sometimes you put the weight back on. At the end of the day, yeah, the meds cost more long term right now. But I would choose the meds first.
Yeah.
At least try it.
I would too. And now when we say try it, we don't mean try it for a month. I would try it for a year, 2 years, 3 years. I mean, my goal, I would never even consider coming off the medication until I've held a weight stable with a decent routine for 2 years. That's my personal opinion. That is anecdotal. I've got no research behind that, except my own.
Gary, insurance companies don't want to pay for the medication. They push you to have bariatric surgery. Yes. Even my insurance, like now, if your BMI is over 40, they want you to go have bariatric surgery, not the meds. Or at least consult with a bariatric surgeon before they'll pay for meds. It's just 40 is not that high that these meds can't bring you back to a normal BMI.
We've had patients with like 55, 52, 55 BMIs have fantastic results on medication. Medication with education and community. We do this for our patients. So we're doing this an hour a week live for public. We do it an hour a week specifically for our patients, small group Zoom. I'd love it to be a large group Zoom. If you're our patients, come then.
Yeah.
because we have 1,200 patients in our school group, because we have an online community that's private to patients, not a HIPAA compliant space, but and we also have a public group at amspublicgroup.com that you can come hang out into and ask questions there. So if you don't finish, like if we don't get your question or whatever, if we're like, hey, we got to go, you can go to AMS public group and ask there and we'll get there. Lena will let me know. Lena will tell me what's out there.
Kathy, I need to change my doctor's mind about it being a lifetime med. She doesn't think it should be. So for some patients, it might not be. For some people, it might be. But I think it should be your decision along with your doctors when you want to come off. Like, you know, we've had patients like drop their weight, come down to the lowest dose and come off and do fine. Other ones come off and come right back on at the lowest dose just to kind of keep their brain from always thinking about food. And not putting the weight back on, you know, because you did all that work. Why put it back on?
Right. Or Amanda's insurance will make her get fat again.
Yep.
To go back on the meds and get it covered. Screw that. It doesn't make, I'm sorry. Okay, I'm going to stop. I'm just going to stop there. We're just going to stop there. We know if you've been here before, you know what I think.
Cookie Marie's started at 311, down 75 pounds since December 1st of last year. Fantastic. That's amazing.
God, I love it.
Yeah. That is bariatric results on medications.
Yep.
Except you get to absorb all your vitamins.
Mhm.
Right. And there's no revision needed.
Yeah.
Like, I mean, that's the thing. We do a sleeve because then we can go to a bypass or, you know, and do further things for more weight loss. Anyway.
Holy crap.
And have a stomach. Yeah. Do you see
Broderick started in February of this year from 305 to 227.
rocking it?
That's awesome. And you're working out. I love it.
Yep.
Please tell me your strength training though. God, I hope you're strength training.
I mean, look, my deltoids are getting closer to similar. I'm working on it.
To your medial head there.
I
Can
know.
I say
Right?
that? Am I gonna get in trouble? God.
That's what she said.
We just
I
got
mean,
banned. All right.
I know. Sorry.
For the YouTubers later. Come here, quick.
Any advice for someone not losing? So do you want
I am totally soaked. My pants are soaked and my shirt.
Okay, go back outside.
My doctor is young and thin. She probably doesn't understand. Now, here's the thing. I've had people see me, especially in the beginning of this whole thing when I lost a lot of weight quickly. They'd be like, "What do you know about losing weight?" I'm like, "Screw you." I'm like, I have battled this demon for over 4 decades. So maybe she does understand, or maybe she feels insecure.
Mhm.
Right? Who knows? Like, oh God, sorry. I don't want to get on that soapbox because I will rant until the freaking cows come home. But advice for someone not losing. I'm going to use Courtney's term of the mathematical hard truth and make people angry. That if you are not losing weight, there is no way we can change the baseline problem of you are eating more than you burn. I'm not saying it's a moral failing, but either we need to increase the way you are, like that's what the metabolic repair is about, right? It's increasing your metabolism, increasing the way your body uses food, better nutrient extraction from food. You're eating too much and we got to figure out how to change that.
Yeah.
Now, the reason why protein helps is because number one, it keeps you fuller longer and it takes your body energy to burn the protein, which is bonus plan. So
Yes, Nikki, that same patient, she's on 10, she's on 10 Mounjaro and gaining.
not a patient, not medical
not a
advice.
patient, person. You're a person.
You are a human being.
If you're on 10 and you're gaining and you have no appetite control, it's time to go up and dose.
That's what I did.
Yeah.
I was starting to put back weight on 10, so I went up.
And add the other things like do the protein, do the fluids, make sure you're resting and getting enough sleep and kind of mitigating stress best you can.
Oh, Broderick, you need to come hang out with us. You are my people. You're
Yeah,
an elite.
yeah, that's awesome.
So, no, I'm lifting weights, doing cardio on the treadmill. We ain't playing no games. We need to come hang out. Go to AMS public group. We need to party. Yeah, it's time to.
Mama, gonna start strength training in the water since I'm limited on weight since brain surgery. Absolutely, any kind of strength training is absolutely fine. Even if it's, I'm not sure clear wise, but even body weight stuff is absolutely okay.
Heck yeah.
You have the extra weight on. You might as well use it while it's all just there, while you're saying bye to it.
I wish I would have. I mean, so things I wish I would have done differently, right? Started 20 years ago. Sorry. No, sorry. I I wish I took about 6 months and I swear all I did was walk for like sanity. I didn't do any strength training. I didn't get enough protein in. So now I'm like rebuilding. And I mean, I'm a 50-year-old woman. It's muscle does not come on quickly. We've talked and weight has never been an issue. Hold on, did I miss something?
I think she meant her doctor's weight has never been an issue.
Oh, yeah. Well, then she doesn't get it.
Yeah, I've worked with a very, very, very naturally slim doctor. And when I had a PCOS patient who I was putting on metformin because I said her PCOS was untreated, she's like, what do you mean untreated PCOS? Is she trying to get pregnant? No, she's obese and she can't lose weight because she's insulin resistant. And right? I mean, aren't you an OBGYN?
Well, she's an OB.
Yeah. Anyway.
Yeah,
yes,
lines are never going away. Never, ever, ever. My what the fuck lines are there to stay.
Andy
Got it right
Richardson
here.
had gastric bypass 13 years ago, but never reached goal weight. Used GLP-1, reached goal in 1.5 years. Or
That's-
1.5 years ago. Fantastic.
Here's your answer. Okay. So we didn't, we have our opinions, right? But opinions, you know what they're like. So, but that's an answer. We have a ton of people or reach their goal weight and start creeping back up again.
All right, so a couple metformin questions. Does metformin 500 daily help lose weight? Actually, yeah, it's super it's like 4 to 6 pounds. It's like super minuscule.
Well, I think it also depends. Do you
It depends,
have
yes.
insulin resistance?
Through that, I did
Because
not. So
I had documented I think my fasting insulin was like 35. Like it was ridiculous. So if you truly have insulin resistance, when I started metformin, when I was doing this was long before GLP-1s. When I was doing all the things, not getting any results, and then I started metformin for the first time, same things, nothing else changed. I dropped 10 to 15 pounds immediately. So it really depends on why your processes are doing what they're doing. So for some people, yes, metformin can cause weight loss. And the next question was, do you take it with Mounjaro? Yes, absolutely.
Yeah, we've had a great success adding it for like compound patients that can't afford to go up in dose to get them going again or keep them losing weight, and people who are at max dose to get them going again. Like it works pretty well. Plus, it's super cheap. It's worth a shot.
Oh, and there's Julie had a question for the Neil and the Maureen. Can we actually rebuild our muscle mass? My arms are flabby.
So, couple things there. First, absolutely, you can gain muscle mass. Get your protein and strength training. One, the flappy might take a little bit of time for the body to kind of absorb that extra skin, depending on how long it's been, and for it to tighten up. Increasing muscle mass in that arm will help with that a little bit. But we won't know for a while whether something else needs to be done, something surgical, or just it goes away.
But I tell you what, I'd rather fit in a medium to small shirt with flappy arms than need an extra large.
I'm telling you, look, we're all waving.
But not with our, oh, shut up, Neil.
But if I tighten up, right? Okay, if I tighten up, I'll tell you, because it's getting better. It's getting better.
Yeah, it's just taking some time.
It's time and triceps, biceps, right? Because you're gonna pull my little Bugs Bunny biceps right here. They're
Don't
trying.
forget the triceps. It's 2/3 of your arm. All right, let's see. Eliana, my doc didn't give me a GLP-1 because I don't meet BMI, but I'm considerate of weight for my height. So I'm 131 and 5 foot tall, so I'm overweight on the BMI calculator.
Yeah, well, especially
Yeah.
for
We treat people like that. Absolutely. So amstelehealth.com. Check out the website, see if we're in your state. If not, we have other options for people that we do like.
Kathy O had a good question. If I have insulin resistance and lose weight, does that insulin resistance disappear? Maybe. Don't I have a really great answer?
I know.
No,
right?
I mean, theoretically, yeah, you could lose the
Almost,
weight, become more sensitive because that you have less fat on your body that's kind of, when it gets large enough, it becomes like kind of its own organ, produces hormones and makes things worse and harder to lose weight. So if you lose it enough, yeah, it might drop and stay drop without meds.
So metformin in the studies is 4 to 6 pounds. Amanda was terribly insulin resistant, so it did correct that for her and cause her to release 10 to 15. Does Mounjaro make you gain body fat? No, not in the studies or real life.
No. Now at the end, if you don't get your protein, don't strength train, you lose a bunch of weight.
You overeat,
Um,
you're going to gain body fat.
Yeah, and then you
Mounjaro
come off the
does.
medication, you're gonna gain fat back because you have nothing to keep the
Nutella
fat
out of
off.
the jar is what's happening.
Oh, so someone with a crown, no name, please answer my question. If I start to take Mounjaro, do I need to stay on it all my life?
Oh,
That's-
wait, somebody asked too, can you take metformin and Mounjaro? Did we grab that one? The answer is
Yes.
yes.
Yeah.
Yes.
Okay, sorry.
So the answer to that question is, it depends. We've guided people off. Maureen and I are both on it and don't plan to come off. So if that is your goal, if your goal is to lose the weight and then come off, there are ways that should be able to be done. You don't get the rebound that you do with white knuckle diet and exercise, of the hormones. So if
I'll
you,
correct your damn website.
Yeah, you see her, she's there. We were talking about you.
if you get to your goal weight and you stable on it, we really advise a minimum of 3 months. We have to try and talk people into that, but a lot of people won't, and a lot of people come back.
After the problem is they gain, right? If you're not ready to go off and you go off, you will gain the weight back. And it's not because of willpower. Willpower is not the issue here. Yes, you do need some willpower. Obviously, don't stick the spoon in the Nutella jar, but you've got to create that space between stimulus and response.
Mhm.
So yes, we were talking about you, Maribel. First of all, if you are in California, go see Maribel. Maribel, are you in Kentucky as well? Because we got a patient for you who wants to chat. I think you're in Kentucky. Thoughts on semaglutide not working for some patients. Yes, we do have them. Rarely, but we do. We just switch them to tirzepatide. We've never had a non-responder that has fully gone through actually working at it, getting up to the highest doses, getting their shit done. Elena Pascalo said, would you guys be able to prescribe me any GLP-1 through telehealth, and do we take insurance? If you are in the states that we cover, Maribel's on here too. Mary Mama down below. Maribel has some of the states that we do not. You can go to, Neil put our website in there, amstelehealth.com, see if we're in your states. Now, would we be able to prescribe? That depends if you don't have any contraindications. It depends, like if you're pregnant, that's a hard stop. For breastfeeding, hard stop. Stuff like that. If you've got a history of multiple endocrine neoplasia, we do not do that. That sort of thing. We've yet to run into one of those. Actually, I did run into one and we talked about it and she wanted to accept the risk and then never followed through, which I'm kind of happy with in retrospect.
Texas Cutie, going on a 2-week vacation, best way to transport compound meds. So if you go to like Amazon or even the pharmacy, they have these little insulin travel cases. Usually has a little slot for your vial, some syringes, and an ice pack. That would be the best way. And then when you get there, put it in the fridge.
Be careful with a hotel fridge though, because hotel fridges can freeze things and that may degrade the peptides. Oh, Maribel, all your states are on there. Yeah, put them in your push profile, please.
Maribel with an A. Did I spell it wrong?
We do cover Ohio, Pennsylvania. Pennsylvania is very recent. And highest dose of Ozempic, I'm trying to hit some of these. It's 2.4 milligram. Oh, Ozempic is 2, but Wegovy is 2.4 milligrams. So if you're asking what is the highest dose of semaglutide, that's 2.4. Do GLPs burn fat or just work by curbing appetite? They curb the appetite, but they also definitely mobilize fat stores that I was never able to access before. I think Maureen was the same way. So they do more than just curb appetite.
Yeah, but they're not fat burners either. So that they don't.
It's not like
direct
speed.
It's not speed. It's not phentermine or hydroxycut for those old people out there.
Hey.
I am one of those old people. Just ask Gorman.
I resemble
Benadryl.
a boomer.
Right? We covered Ohio. So does Maribel.
Yeah, next, thank you very much.
Yeah, they really, that's what we're talking about, kind of the metabolic repair. They help your body do what it's supposed to frickin' do in the first place.
Oh, Maribel says they're on there.
Maribel, I thought I looked. Where? I just looked. Hold on. Maribel Telehealth. Is there a different website?
That
Oh,
was
you know
for
what? No,
PUSH.
I see Maribel Campos, MMS, PAC, medical professional school specialty, professional fees. Yes. That's all that's on there.
I don't know what this one means. Andrew Richardson also have PCOS, highest dose of tripeptide, does she mean tirzepatide?
Yeah.
Was 10. Does that mean that's the highest dose you were on? Because it goes to 15.
Hold on, Maribel with an A. Where the hell's the A? I'm coming
Oh,
up.
MAR. I guess I spelled it. I think I put MER in the
Oh,
comments.
Oh, I got that, but I don't see the
Yeah.
state. So.
I don't see the states either.
Okay. Good.
Hmm.
I'm sorry, Amanda. I interrupted.
That's all right. I think I don't understand. I
Cause
don't,
cancer and thyroid cancer. In mice. Yes, it does.
yeah.
Multiple endocrine neoplasia. I don't even know what the studies in that because no one talks about it. But mice have GLP-1 receptors in the thyroid that are specific to medullary thyroid carcinoma.
Maureen, they want your chart. They want your graphic.
Can I explain the mechanism that leads to fat loss? Shit.
There's many.
Yeah, it affects what, 13, 14 different organ systems? Feedback, hormonal feedback.
Oh,
Google-
well, so
Google
eliminate- it doesn't
GLP-1
cause-
organ diagram. Try that.
So Elena says if it causes cancer, why are so many potato? Well,
Yeah,
it didn't.
It's gonna cause cancer in mice.
The mice.
Yeah.
The
In mice.
little mice who were taking like a, what, 1,000 times dose.
Yeah.
Um,
Don't give your pet mouse GLP-1s.
And it was a specific thyroid cancer that like 20 people have ever gotten that type and it had nothing to do with GLP-1s. Like it's a super rare cancer.
So now does
Again,
metformin prevent cancer or
Yeah,
cause?
the mice live to be 100. So if we're going to go off mice again, the little mice live to be the mouse equivalent of over 100. So
Wow.
there you go. Did you know that?
I did not know that.
That's the longevity study of metformin.
That's pretty funny.
Because
Little
the mice,
little
little arthritic
baby.
mice.
So there are 13 different cancers that are worsened by obesity. I thought there were only 38 disorders that are worsened by obesity. I thought COVID was 38th, but unfortunately I looked and there's like 264 now.
Mm.
So we're looking at, it depends on what you want out of your life. I was just in a call before this and the guy that was talking, I was trying to look at his hat. He had a baseball hat on. I was like, what does that say? And it said, fuck average. And I'm like, I love that. Thank you very much. You know what, if you just want to like sit in a chair and wait to die, right? Which if you're here with us and you're hanging out, you probably don't. We run a lifestyle medicine practice where, your primary care doctor is going to get you to a C or a B, we want you to live an A plus kind of life, right? We want to get you to the best you could possibly be. And I'm not talking perfection, right? There's no perfectionism involved here. We just want constant improvement because if you're not getting better, you're getting worse. And it does take effort. That's why. So in 2 weeks, this will be an hour long and I have to hard cut it off at an hour because I'm going to start a VIP life coaching group for the second hour that we're going to go over there and it's not going to be easy. I'm almost done because I'm being a perfectionist, getting the info sheet done for that. And it's not going to be easy. Nothing we do in lifestyle medicine, nothing we do. It's rolling a ball up a hill because the universe favors entropy, favors disorder. That's why you roll down the hill, right? That's what happens. You've got to make an effort to stay on top of the hill. It just depends what you want. We're not going to make you order compounded meds. We're not going to make you do anything. We're going to give you options. We're going to give you education. We're going to give you community, and then we're going to succeed. That's how we roll. Okay, somebody else. I'm off my soapbox in bed.
All right, so where was that one? Okay, so you say it was medullary cancer. Is anaplastic carcinoma one of those? No, they are different. The anaplastic is super aggressive and rare all as well.
I'm late, but I have great news. 30 pounds as of yesterday.
Nice.
Party. How do you feel? How do you feel? I bet that feels amazing. Finally.
So I was reading some stuff like orthopedics, and they were talking about like, like weight loss and stuff like that. And because someone was told that, like their joint problems was because of their weight. And apparently every pound of weight loss is 4 pounds less on the knee joints.
Correct.
Like it's an insane amount. So when you even dropping 30 pounds, that's 120 pounds less on your knees.
That percussion, anytime you hit from back in my athletic
Yeah.
trainer days, is when you hit the ground, it is 4 times your body weight through that knee.
Yeah, and I even saw higher ones. Like I even saw up to 9 pounds. So maybe it depends on like
That is running versus
body
walking.
mechanics, but I'm like, holy crap.
Right.
30 pounds. Yeah, busy GLP-1 mom. So your knees have 120 pounds less on them right now. Which is great.
Hey, can I hold on. We're trying to do, come on, you guys, I have nothing. I have nothing.
All right, Christine Getting Healthy says, what doses of metformin are safe when combined with Mounjaro, or does it depend on person's comorbidities? I would say
It depends on the comorbidities if you're
Yeah,
looking at lactic acidosis. That's a plus,
Yeah.
but we start with one. We would certainly not be offering medical advice or dosages here, but we start with one with dinner and usually stop at 2 for anybody non-diabetic. That's probably all you're really going to get out of it. I mean, I think after that, you're probably not really going to get an additional benefit.
No. Neither medication should technically cause low blood sugar or hypoglycemia. They all have that as a risk for them, but they should not cause that.
How much should Carrie says, how much should one lose each month on meds? A steady weight loss is 1 to 2 pounds a week, whether it's this med or anything else. We do have sometimes every once in a while, somebody have a dramatic weight loss, especially on initiation. I talked to a guy on a video visit. He had 25 pounds, or no, somebody. I can't remember if it was a text or, but he dropped 25 in the first month, but that's unusual. And I made sure he was aware of that. So 1 to 2 pounds a week is a great rate on the meds or not. And really faster than that is really not great. I would probably either keep you on the same dose or slow you down if that happened.
I don't know though, because a lot of the studies show that rapid weight loss is in fact better long-term. So I think it depends on if you're meeting the protein goals, right? Or you're just stripping your muscle down and losing 50% of your weight loss from lean body mass, that's a bad freaking idea, no matter how you slice it, right? So I think there's a lot of factors that we can't just do a blanket statement of, yes, it's good, yes, it's bad. I think like for me, if I was so motivated by the quick weight loss in the very beginning, because I finally had hope after 40 years of really not having any.
Yeah.
So that was, that I was willing to lose a couple extra pounds of muscle for sanity.
But the biggest thing for this is it's hard, and it's hard not to, is to compare yourself to others with how much weight you're losing. Because like she was saying, like that one guy lost 25 pounds. Like on TikTok, I've seen like ridiculous amounts, 30, 40 pounds the first month. That's not normal. A pound, like she's saying, half pound, 2 pounds a week. Perfect. And if the first month or two you don't lose weight, that's fine too. We're just escalating the dose and to get you to a point where you're going to lose weight.
Yes. Maribel lost weight and her gallbladder.
Nice.
Kristen Haas says, what are your thoughts on low dosing to start, as in 0.125 of semaglutide? My thoughts are, I would like to know why you want to start that low, but if you're concerned about side effects and you want to ease your way into it, that's totally fine. And if the 1.125 goes well, then redose in 3 or 4 days,
Yeah.
But yeah, I don't have a problem with that. You just probably aren't going to get any dramatic results at that. So.
I do have one of the nurses that recently started with us who was terrified of the side effects. So she took the 1.125 and she's like down 9 pounds like, in the first month. I'm like, oh my God,
Nice.
it's super effective on her.
Perfect. And it's cheap.
Uh,
Does GLP-1 weight loss help with prevention of genetic congestive heart failure? So I think it depends on the genetic congestive heart failure part. Like if you're looking at a cardiac abnormality, yes, your heart is pumping against less adipose tissue. So it has to work less. So different kinds of heart failure, like preserved ejection fraction heart failure, this will make a difference. I don't think it would ever hurt that's my 2 cents, as a non-medical opinion.
we got an anonymous, hey, random question. I feel nausea when weightlifting and feel nauseated the morning after.
I'd work on your electrolytes.
Yeah.
Is it now? I would also wonder if this is someone new to weightlifting. I'm wondering if they're having lactic acid buildup.
Yeah, if you're a metformin, you got to not do that, stuff like that, watch the timing of your metformin and or are you dehydrated? Are you eating something beforehand where you're causing reflux? So it's really so these are the kind of things is a very good example that we can throw some suggestions out. Well, this isn't medical advice anyway, but when you are our patient, you get literally unlimited texting back and forth, which is pretty nifty.
Nurse Alyssa, I'm curious. I'm literally doing my final FNP project on GLP-1s and PCOS with fertility. Are they studying this? To my knowledge, I mean, we know it happens. But
This week, I said goodbye to 3 patients that got pregnant.
Oh,
Yeah.
shit.
This week.
I had to in person.
Babies?
I had to in person inform someone that we do not recommend actively seeking pregnancy on a GLP-1 because she had gone to someone else who gave her compounded medications and never asked her even once if she is preventing or trying for pregnancy.
Yeah, pills are not enough. You need a barrier method, which means condoms, diaphragm, and even then, I would probably do an implant or injection.
Non-oral method. I do the ring a lot. The ring is fine.
Rings, okay.
Okay. Yeah,
Was that-
Amanda's our women's health expert here.
You just can't involve the GI system. So the ring is perfect option.
You guys think smart scales are accurate with body composition info? Just curious. I do not.
No, I
It
wish.
depends on hydration status, how muscular you are.
And I think they
But-
can give you an idea.
Right. You can
If you
watch
want
trend
to
with
see
them.
a trend, then they're useful, but you can be your body fat percentage on a scale can swing by a full 10% during one day, depending on hydration.
Yep.
So but if you weigh the same time, the same hydration level, you can at least give yourself an idea of a trend.
We have 10
Anything-
minutes. Keep going with your questions.
Anything you would recommend to have on hand when starting probiotic, digestive enzymes, etc. So if you're really concerned, I would ask your provider for like some anti-nausea medicine. Otherwise, you want like Tums just in case you have like some acid reflux, and hydration drinks and protein shakes. Those are the biggest things that I would have on hand. Penelope, I just started 1 milligram yesterday. I'm hoping for better results. The last 2 months doses, I only lost 6 pounds. And that's okay. First you're down 6 pounds still, which is fantastic. And some people, those aren't the weight loss doses. The 1.7 and 2.4 are. So you might just need to get a little higher. Most people do feel 1.7 pretty good. So I am hopeful that that is the dose for you before you have to go up. Lacey, since I've been on 15 for more than 6 months, I'm no longer losing weight. Does that mean I should be working on getting off of Mounjaro? Not necessarily. No, like I would just look at other things that you're doing. With our company, we have like our 5 pillars or 4 pillars. And the biggest thing is making sure you're getting your protein in each day. Typically for women, it's around 100 grams. Men, it's 150 grams a day. Make sure you get enough sleep, staying hydrated, mitigating stress. That or talk to your doctor about adding something. We have had really good success with adding metformin to our GLP-1 patients that either can't go up because of financial or there's nowhere to go.
speaking of financial, we've had a couple of questions about pricing. We are $89 a month for our medical care, and we have 7 different compounding pharmacies that all have a range of prices for the medicine. Those go directly from them to you. We handle the money exchange because most of them charge more for direct to consumer. So we're trying to save you the bucks by marking up less, or if at all. So I think, because there was a few of the, what are the fees? And
Yeah,
didn't know-
tirzepatide. So
Yeah.
depending on the
Exactly.
state, semaglutide starts about $150. Tirzepatide starts at around $200 for the low dose for the first month, but it can vary by state because some pharmacies don't ship to certain states. That's about where it's at. Let's see.
Candace is asking, do you recommend an endocrinologist struggling to lose on 10 milligrams of tirzepatide? That's a lot to unpack in that question. If you have an endocrine issue, then certainly an endocrinologist may be able to dial you in a little better, but you just may need a higher dose. It could just be that simple.
Or, that's a possibility depending on who's handling tirzepatide for you. You just might need a little bit more involvement and to change some things, not necessarily going up in dose, focusing on protein, making sure you're exercising, hydrating, getting good sleep. But like Amanda said, it might be time to go up in dose. I don't know necessarily if an endocrinologist is going to have the best knowledge for just simple weight loss. I think it kind of depends on the endocrinologist. I think finding someone who does primarily weight loss would be beneficial, that has a very good experience with these medications.
I did recently come across one here who was very supportive, so I was very excited. I
Yeah.
need to write his name down and be like, this guy. But
We
she had
are
a
in
thyroid
Texas.
issue, so.
All of us are in Texas. I'm gonna start winding the live.
Except Amanda.
Except the man. No, we
But
are
she
all
can-
licensed in Texas.
We're
Thank you.
licensed. She's not physically here, but we are physically in Texas.
We are physically in Texas for now. But yes, we service, everyone has licenses in Texas. So, ship to Louisiana. Some of our pharmacies will ship to Louisiana. We just send the prescription. So yeah, we can send a prescription. Just kidding. But yes, some of our pharmacies will ship to Louisiana. And I can't remember which one had the 200. We have a couple that are right around 200 for
Yeah.
tirzepatide, 2 or 3 pharmacies that are like 200, 210, I think, depending on the state.
Oh, but the big thing, so you can go to our website, amstelehealth.com, click become a patient. We don't charge you anything until we make sure it's a good fit and or you want meds, or to kind of join us. We can talk about pricing and everything like that. And you can still decide maybe not for you guys. And that's okay.
Yeah.
We
Maybe
want
we're
you to have
all
the best care
crazy.
either way.
Yeah. So, and that's one of the big things, is that we do not charge you until we come up with a plan that is satisfactory on both sides. We have to do that in a HIPAA compliant space. This is not a HIPAA compliant space. This is not medical advice. Next week, 1 o'clock. Amanda's leading the show. Okay, Amanda's loaded up. So
Leading?
Skylar, Mounjaro is better in studies than Ozempic. Tirzepatide is better in studies, but some people have plenty of success on semaglutide. Lots of people have plenty of success on semaglutide. The website is amstelehealth.com. And if you want life coaching, thank you, Neil. If you're looking at life coaching, right, because we're doing a VIP call after this one starting on July 16th, just DM me success on any social platform and I'll find you. We absolutely recommend any GLP-1 that's out there for somebody who needs it.
Yeah, Wegovy might be fantastic for you. I loved semaglutide. I thought it was a wonderful drug. I've had patients switch and they like one better than the other. So everybody's a little bit different.
Yep. They're just
Do you help with prior authorizations if they cover Zepbound? Yes, we can do prior authorizations. However, sometimes the insurances are really, really picky. They keep changing their criteria. We do not take insurance. You can use your FSA or HSA card to pay for compounded medications. But otherwise we're cash based with regard to that.
And
but yeah, we can help with the PA.
If you get a prior authorization approved, the shortages make it so that you may not be able to get the dosage anyway. Mounjaro through us. So we prescribe it. We have 7 different pharmacies. It starts at about $200 depending on your state. Like Neil said, go to amstelehealth.com.
Skylar's on it. She's already on the priority sheet.
Holy shit. Nice job.
She will be greeted momentarily.
That's how fast we work, man. That's how we roll. All right.
Yeah, and Skylar, like theoretically, if you know you guys go back and forth, make decisions, get everything taken care of, like it could
Start
get ordered today and shipped tomorrow, and well, maybe not tomorrow because of the holiday, but we'll see.
Oh,
I'm
yeah.
not sure how the holiday
Forgot
stuff
about the
is
holiday.
going.
Oh, yeah. I don't know if the pharmacies are closed on Friday or not. I have
The
no
real
idea.
Mrs. Roy, like we, you know, if you go to our website and we're not in your state, we do have people that cover other states. Maribel Telehealth covers a bunch of states, and Hamilton Telehealth, Nikki Baldwin covers a bunch more states.
Yes.
And if you can't get those names, you could always join us
Skylar?
and we can message you those later on.
Yes. And
Not a
or
problem.
yeah, so because now we have a pull down for the states in the intakes. So if you can't, just go to amspublicgroup.com and come hang out, because then you can come hang out with us. Even if you're not in the states, it's just coaching and education, not medical care. Because this isn't either, right? We're just chilling. We're just chilling. So next week, same bat time, same bat channel. It'll change the week after that. We'll tell you for sure. I'll post on all the socials.
Skylar, you can give me a follow too. Don't be
yes,
shy.
yes.
Follow
Follow
me, Skylar.
And Amanda.
Follow the people. Follow the people. On okay, on YouTube it's this way, but it doesn't make any sense on YouTube. So we're just gonna do the TikTok.
Yeah, we're all over the
Follow
place.
the people. Sorry. We get a little goofy after a while. Oh, I still have 2 more calls. All right. That's okay. It's okay. It's what I do. So on that note, have a fantastic Independence Day. If you want to be independent from the shit that's holding you back, go to amstelehealth.com. Come find us. We'll get you there. If you have any questions, go to amspublicgroup.com. You can go to atcpublicgroup.com if you want to find me for life coaching, or just DM me anywhere success. That whole shit's going to change in about 15 minutes. It'll be officially launched in about 15 minutes. No, I love doing it. I do. I do. It's just, holy shit. Like I'm going to finally do it. It's like 40 years I wanted to do this. And I was like, fuck it, I'm doing it. So anyhow, on that note, we're going to shut down the TikTok live first. And then say goodbye to the tube, 2,400 viewers. So thank you very much to everyone who was out there. Come
Yes.
see us